Great to have you along as we launch into another edition of It's All in Your Head here on Experts on Call with our guest, the very noted neurotherapist, Dr. Paul Swingle. And in the past, we've done a lot of programs to try to give you information on how to deal with conditions such as ADD, alcoholism, and addictions. We've talked about depression and mood disorders, fibromyalgia, pain disorders. And we're going to do something a little different today, although we welcome your calls on any of those or other topics that refer to the brain. And that is performance enhancement, optimal performance, and also the brain sharpening for the elderly. And our guest is one of the leaders in the field of biofeedback and neurotherapy, the medical science of adjusting brain waves. We're very lucky to have him here in Vancouver answering your questions. Dr. Paul Swingle is here, and It's All in Your Head is on the air. Nice to see you. Happy New Year.
Happy New Year to you.
We talked about seasonal affective disorder the last time you were here because it was kind of an appropriate topic for the time of year. And you just gave us all sorts of great information about how to deal with it through what you do at the practice. And so it's a little different today, a little different focus, but a lot of great information on athletes, CEOs, performers, artists. You have quite a few people like that come into your clinic and actually have their minds sharpened prior to events or performances.
That's right. We see a lot of folks, CEOs of large companies, athletes, and of course the elderly, to keep the brain sharp, prevent dementias, delays Alzheimer's, correlates very well with good immune functioning. So getting the brain in shape makes a lot of sense for a lot of folks. And the best comparative is physical fitness. You get your body in good shape, it can prevent a lot of things, and it can enhance performance. So what we're going to be talking about today is the treatment of athletes for peak or optimal performance, artists who don't feel that they're quite at the top of their skill, CEOs of large companies keep the brain sharp. It's a very good investment for a large company to increase the brain power of their senior executives. Money well spent.
And for creativity purposes, decision-making purposes, confidence, and all that kind of stuff. What about for people who are now 2 weeks into their resolutions to get fit, eat better? Can you help those people out too?
Present company accepted?
Yes, absolutely. I've been eating fruit and vegetables like all morning long, for heaven's sakes.
Well, yes. As a matter of fact, there is an area in the brain that's associated with negative self-talk. And if it's hot in your head, Peter, we can we can fix it up for you.
Actually, I've done very well. Maybe it had to do with the treatment I had last year with regards to the sleep. One of the impetuses for this particular subject was this past year's World Cup in Germany, and the Globe and Mail, the Vancouver Sun, and even the New York Times ran a story about how the world champion Italian national soccer team, their secret weapon, and that was the focus of the story, was neurotherapy. What do you know about that, and how did that all come to be?
Yes, it was revealed after they won the World Cup that their secret weapon, in fact, that was the actual title of the news articles, their secret weapon was neurotherapy. And they had an area that they referred to as the mind room. They did a number of things there, but one of the fundamental things that they did was neurotherapy. And what you do in neurotherapy for optimal performance, the first thing you do is normalize the brain. So any areas in the brain that are not functioning well, efficiently, you bring them into normative range. Now, you do that with anybody who walks in the door. Somebody who comes in the door with a sleep disturbance, for example, you normalize brain functioning. Once you've done that, then you can move into what's referred to as optimal or peak performance training. And there are some very specific things that you can do. With the Italian team, once they optimize brain functioning, then they use some of the other sports techniques, psychological techniques. For example, when the brain is operating very efficiently, you have them visualize something like the foul kicks that they did, and that's how they won the game.
Penalties, yeah, that's right.
That was one of the principal things they did in the mind room, was have people visualize doing the penalty kicks when the brain is working very efficiently. Now, there's nothing new about this. They did some work with Olympic archers, I'll bet it's 20 years ago, and they found that if you monitor the brain during the process of drawing back the bow, aiming, and then releasing the arrow, as you're building up to releasing the arrow, there's a very large increase in the amplitude of fast activity in the brain. The moment the archer makes the decision to release the arrow, that high frequency should drop like a stone. and slow frequency should come up. And that's exactly what happens. And the speed of that is directly related to accuracy. Now, that's a phenomenal finding. So when you work those parameters in brain activity, you can make a substantial change in optimal and peak performance. Now, it's not only athletes. The opera and
ballet dancers?
Ballet in New York City. There's a woman there, Ray Teitelbaum, who I know very well, who specializes in dealing with performers in optimal and peak performance. And I've attended some of her workshops and demonstrations, and you'll have a person sing, and then she'll do some of her treatment, and then the person will sing again. Unbelievable, the difference. Just unbelievable.
Well, it's funny about the Italian team because one of the knocks on them had always been in past World Cups and not being able to win it was the mental aspect of penalty kicks or, causing fouls. And you watch through the course of this past tournament how sharp they were in not making them. And they have everything. They have the skill. They have the passion. But it came down to penalties, which takes a level cold head, and they were icy cold when it came down to that point. Isn't that interesting? We'll talk more about that, and of course we could talk on any subject you wish because Dr. Paul Swingle is here, and his job is to help you overcome all sorts of disorders, whether it's alcoholism, autism, whether it's dementia, depression, mood disorders, even fibromyalgia, and certain pain-related disorders. He's here to help you and answer your questions. In just a moment, Dr. Swingle from Swingle & Associates will tell you exactly what biofeedback and neurotherapy is. If you haven't heard those terms before, it's been around for 40 more years than that.
That's correct.
But it's still not part of mainstream medicine, which is one of the reasons why you're going to Palm Springs you're doing a lecture down there to talk about exactly that.
Yes, I'm giving a 2-day workshop there and then a 1-day workshop in Monterey a little later, teaching primary care practitioners, primary care physicians and psychologists how to do neurotherapy. So that if somebody comes into a physician with a sleep problem or depression or anxiety, they can do some neurotherapy and correct the problem at its source rather than medicate and sedate it.
We'll talk about neurotherapy, biofeedback, what it does and why it lasts forever once you've done it. When we continue with It's All in Your Head, you're listening to Experts on Call with Swingle & Associates and Dr. Paul Swingle here on CFUN 1410 AM. The telephone number at Dr. Swingle's clinic, by the way, which is on Melville Street, is 604-608-0444. That's 604-608-0444. We're talking about peak performance, optimizing performance, also brain brightening for the elderly. A question that actually I get asked a lot about this show is whether or not neurotherapy can identify tumors in the brain. Can you?
We can see areas of inefficiency and areas that are not functioning correctly when we do the full assessment. And what it usually indicates is traumatic brain injury. Now, the procedure that we use is looking at brain function, not brain structure.
Right.
So if you're talking about a tumor, for example, we can see an area that's not functioning efficiently. But to determine whether it is in fact a tumor, you would need an assessment of the structure of the brain, and that's a SPECT or MRI, that sort of thing.
You've been helping people with neurotherapy and biofeedback for so many years. I mean, you've spent your whole life studying the human brain. So take us through the procedure. Somebody comes to your clinic. They sort of know why. You don't know why. And you make them do what you call a brain map. What's that all about?
When people come in, we don't ask them why they're there. We let the brain tell us what the problems are. So the process would be a person would come in and we would set them up, put a wire in each ear and one on top of your head that would be moved around to various critical sites in the brain. And what we're doing is measuring the electrical activity coming from the brain. The person would not feel anything. It's measurement only. And it is an electroencephalograph. That's what we're measuring, which is the same thing that you would get in a hospital if you had an automobile accident and they brought you in to do what's called an EEG. Now, we're looking at function of the brain. How is the brain functioning? It's not the structure of the brain that we're looking at. So I'd be asking you to open and close your eyes at various times. I'd ask you to read something or count, so we can get an idea what the brain looks like when it's challenged. And I also test some of the products that we're likely to prescribe for your home use, things like harmonic sounds, for example, to determine exactly what it's doing to the brain before we prescribe it. Now, after we do the brain assessment, which only takes about 15 minutes, then I do some calculations and I sit down with the client and go over the numbers in very great detail, and I tell them why they've come to see me. The clients feel that it's quite a remarkable experience because they expect to come in and have to tell me in rather great detail what the problems are. The brain tells us everything, so I can indicate to an individual what kind of cognitive experience they have, their memory functions, depressed mood states, whether they can shut their brain off or not, and so forth. Now, once we've done that, then the next step is to determine exactly how we're going to normalize all of that activity, that is, all of those areas that are not working efficiently. In general, there are three types of neurotherapy that we use. The first is brainwave biofeedback. That's the type of neurotherapy that most people are familiar with. There we set it up so that when the brain is doing what we want it to do, the person hears a tone or sees something move on the computer monitor. If it's a child, they play a video game with their brain. An ADD child, for example, an attention deficit disordered child, if they're paying attention, then an aircraft flies, and they're flying an aircraft through some complicated, mountain chain. If they lose attention, the plane stops. The second class of treatments are the brain drivers, and my clinic is number one in North America in the development of those procedures that are now being used throughout North America. We measure a particular aspect of brain functioning, and based on that measurement, we stimulate with light, sound. With adults, we use microamperage stimulation, EMF fields, and so forth to nudge the brain into more normative functioning. That can be very, very efficient. It's a very rapid way of getting brain change. The nice thing also about that is we can treat people with Alzheimer's, severe dementias, autistic children, and severely intellectually delayed kids who can't really pay attention to do brainwave biofeedback. The third class of treatments are basically home-based, things like cranial stimulators, harmonic sounds, and so forth that the person takes home and self-administers treatments. We've developed a lot of those things so that it markedly cuts down on the number of office visits that we need. So it makes the process much, much more efficient. So the individual doesn't have to come into our office a lot as they used to have to do, 15 years ago. The development of these products makes it much more efficient and cost effective.
When I first met Dr. Swingle, I didn't expect that I'd be doing a brain map. You offered it, so I tried it, and it was amazing afterwards when you told me all these things that, does this happen to you? And one of those things was not being able to turn the brain off at night. Mm-hmm. So at 3 a.m, I'd wake up and start thinking and thinking and thinking before you knew it was 5 o'clock and time to start getting up again. And the whole time and all the treatments, it was extremely relaxing. And the hardest thing for me, I felt, was staying awake. Mm-hmm. But after the first brain driving session was when I actually felt something different. Mm-hmm. And then the next time I felt something different again, which was a little bit of depression, which you said was normal. Mm-hmm. And then after that, I've been able to sleep normally, I didn't think I'd ever be able to sleep normally again. Mm-hmm. But that's just one example. I mean, there are so many things that you treat, and that's the amazing thing. Today we're talking about peak performance, your secret weapon, optimizing performance, brain sharpening for the elderly. But really, the amount of conditions that you treat is really quite amazing.
Really, it's the new medicine. So that not only can we treat conditions, we can do preventative things with the elderly to prevent dementias, and we can help optimize things. So rather than people taking uppers and, that kind of nonsense, we sharpen the brain for executives, and their brain power increases. I think I told you one time that just doing regular neurotherapy, your IQ goes up by an average of about 12 to 15 IQ points.
You can also tell a person's IQ after a brain map, not the exact number, but roughly, where they sit.
How efficient it is, yes.
Right. Mm-hmm. Dr. Paul Swingle is here from Swingle and Associates, and we have Marcia on the line calling in. Marcia, thanks for waiting. You're on with Dr. Paul Swingle. It's all in your head here on CFUN.
Oh, you're welcome. Hi. Hello, Dr. Swingle.
Hello.
Hi. I've listened to you on the radio before.
Yes.
I'm phoning because I suffer from depression, and I've been taking medication for it for a year now.
Yes.
And I was wondering if you could share some information about it, and can you come off of the medication that I'm taking?
Yes. There are a number of ways that we treat depression.
Okay.
It's important to come off the medication at some point because you're going to pay a price down the road for the use of these medications. There are a number of different forms of depression. When we do a brain assessment, we determine exactly what the predisposing factors are.
Okay.
Individuals who have neurological predisposition to depressed mood states, what we do is correct that predisposition. Now, you can have depression with anxiety, so there would be another area of the brain that's associated with the anxiety component of the depression. A lot of people don't have that, and they have only depressed mood states, not the anxiety.
Right. Yeah, well, I found for myself that it was hard for me to get up and do things and stuff, right?
Mm-hmm.
Like to go on to my day-to-day basis.
Yes.
And so I went to my doctor, and he prescribed an antidepressant.
Mm-hmm.
So I don't know, and I also wanted to share with you, I don't want to take up too much time, was that I also was watching TV the other day, and I came across this commercial on the TV. It talked about if people, because I always smell burnt toast every once in a while.
Mm-hmm.
And I don't know that might be a whole different topic in itself, right? Mm-hmm. And I'm also in my 50s as well, so I'm wondering if going into menopause causes depression as well.
Can be related to that. Anytime you have a stressor on the body, if you're predisposed to something, the stressor is going to manifest it. Mm-hmm. Now, with regard to smelling the burnt toast, did this happen prior to your taking antidepressants?
It did happen to me before I took antidepressants, mm-hmm. and I didn't realize that when I saw this commercial on TV, it said you could be having seizures over
That's correct, yes. There's probably an area of the brain in which you're having seizure-like behavior. That doesn't mean that you have shakes or anything of that nature.
Right.
Sometimes it can mean that you have unusual visualizations and so forth. There's an area of the brain associated with that, and if you did a brain assessment, we would have a look to see what's going on there.
And it's interesting that depression brings a lot of people into your clinic, but at least Marcia here understands what the symptoms are. A lot of people go through their life without even knowing why they're feeling the way they do to do anything about it. So, Marcia, I could tell you, here's the telephone number at the clinic. It's 604-608-0444. You can also go on Dr. Swingle's website. It's swingleandassociates.com. Swingleandassociates.com has all sorts of great information there, his phone number, where he is, and all that kind of stuff. We're going to talk a little bit more about medication here in just a second, because it's one of your big focuses is to get people off medication and doing it the right way. Depression is a very common thing, and you were here actually last time talking about mood disorders and seasonal affective disorders and how we're kind of a little bit more prone to it here in the northern latitudes. Just listening to Marcia, what kind of depression, just from your experience, do you think that she suffers from? Is it something that she's just predisposed to? Is there perhaps a traumatic event? What would you say?
It's hard to say from just listening to a person, but if we did a brain assessment, we would know instantly. A lot of individuals go into depression because of some event, death of a loved one, for example. We refer to that as reactive depression. And if we did a brain assessment and saw that this individual did not have a neurological predisposition to depressed mood states, then we would be very cautious about how we proceeded. It's important not to sedate a reactive depression. So, for example, individuals who go on an antidepressant to deal with a reactive depression, what they're doing is creating a problem, because at some point they're going to have to deal with that. And very often what happens is an increase in medication, and the situation really gets quite desperate. The other kind of thing would be seasonal affective disorder. As we spoke about last time, in Australia, it's an almost unknown disorder. It's like 0.3%. Where I think the data were from New Hampshire was 7 to 9%. Maine, I guess it was 7 to 9%. So it's light deprivation, and there are things that we can do about that. One is neurologically to decrease the predisposition to that condition, and then give you some ideas of what to do at home. Light sources, increasing temperature, and so forth.
Here's the thing about medication. Doctors will prescribe things like Prozac or Paxil and all these kind of things. And, I had Prozac prescribed to me once. It's not a problem getting you onto it. It's when do you know when to go off it? And then you start to think, well, do I need this for the rest of my life? I mean, I feel good now. What if I'm without it? There'd be that little panic every month when you didn't get your pills and you thought, uh-oh, what's going to happen? But you got some very important information about weaning oneself off of medication. There's a science to it there, isn't there?
Absolutely. One of the problems associated with antidepressants is if you start to come off the antidepressant and you go into a normal depressed mood state, everybody gets depressed. You start to think, oh my goodness, I'm falling back into the hole, and you go back on antidepressants. So you're never in a situation of getting your brain regularized. It can be a very, very serious problem. Titration is something that we work along with the primary care physician who's administering the antidepressants and put the person on what's called a titration schedule, in which you very gradually decrease the amount. There are some antidepressants that are very unforgiving, extremely difficult to come off. Others are very forgiving. You can come off relatively rapidly.
You certainly do a lot of work with kids, and I know that's a really popular subject. So if you have a child and you're not 100% sure if maybe they're suffering from something that you don't know about, why don't you give us a call here as we continue our discussion about neurotherapy and biofeedback. Now, we wanted to talk about the elderly a little bit here today, because you have a system by which you can help them sharpen. So what happens to the older mind?
As we get older, we have age-related declines in neurological functioning. Technically, what happens is the alpha frequencies, which are brainwaves between 8 and 12 cycles a second, those frequencies start to slow down. And as they slow down, brain efficiency decreases. The good news is neurotherapy can correct that problem. Now, what we do is keep the alpha fast, as we say. And if we can keep the alpha up into an acceptable range, then it prevents dementias, it delays the onset of Alzheimer's, and it correlates very highly with good immune functioning. So there are very significant benefits to keeping the alpha frequencies fast. Now, incidentally, that's exactly what we do with athletes. We make their alpha very efficient so that decision-making is markedly enhanced. Brain efficiency, brain site to brain site communication is enhanced. Now, with the elderly, an age-related decline, that's the one exception to the rule of once it's fixed, it's fixed. So when you get to be my age, about 3 sessions a year is adequate to keep your alpha fast enough to prevent the dementias.
And you call it brain brightening, right?
Yes. And we would also prescribe some things for the person to use at home. There's a harmonic sound that you can play while you're reading a newspaper, for example, that we have demonstrated speeds up the alpha frequency. So it's just an easy way to maintain good alpha functioning in between the visits to do some neurotherapy.
You're listening to Dr. Paul Swingle, one of the leaders in the medical science of adjusting brain waves, called biofeedback and neurotherapy. The program is called It's All in Your Head. We're here every single month. In fact, next month on February the 11th, we'll be here talking about post-traumatic stress disorder. Dr. Paul Swingle from Swingle and Associates, and you could find his website at swingleandassociates.com. That's swingleandassociates.com. All sorts of great information on conditions, contact information, even some case studies and testimonials. And we were talking about age-related declines and brain brightening, and there's actually some interesting information that you dug up from Florida on that very subject.
Yes, there have been a number of studies looking at the effects of increasing, as I said, the alpha frequency. Dr. Tom Budzinski did a study almost 10 years ago in which he worked with elderly in a retirement area in Florida using a device designed to increase alpha frequency. And what he found was really quite remarkable in terms of test results, cognitive functioning, memory function, and interestingly, good health. There have been other studies, as one very recently, again from University of Miami, on the effect of very brief neurotherapy sessions in terms of, again, increasing alpha frequency on cognitive functioning of the elderly. You know, it's interesting. We've been wondering about the effect of keeping alpha fast on the accident proneness of the elderly. Accidents are a very significant cause of mortality in the elderly. And as your alpha slows down, your tendency to be more accident prone appears to increase. Now, there are several reasons for that, and that is if there's a modest change in the environment, the elderly seem not to be able to recall that, so they trip over furniture, for example, that's been moved, that kind of thing. And one of the things they recommend is, you may know if you look at the literature in terms of how to deal with the environment of the elderly, is you don't make any changes like that. But that could be directly related to alpha frequency. As your alpha slows down, your ability to process that information, remember it in short term, is affected. So we've been wondering whether the folks that we've been treating are less accident prone, more capable of driving, things of that nature. It would make perfectly good sense, of course.
It's very interesting. My own dad, how many times he calls me by my brother's name or forgets something that he told me, like 2 hours ago, is quite funny. And also falling, and that's where you see a lot of hip injuries and
that's right.
All that kind of stuff. When I played sports as a kid, for whatever reason, I punished myself by always being the goaltender.
Yes.
The goalkeeper in soccer. So you could literally stand for 3/4 of the game and do nothing. And then all of a sudden the other team will come down and score on you, and you feel as though you've somehow let them down, which creates all sorts of self-doubt in your mind. And it's a very easy position to negative self-talk yourself.
Yes.
And that's kind of what you do when athletes come into your clinic is to get them out of that cycle.
Yes. There are a lot of things associated with that. One is referred to as cognitive behavior therapy, in which the negative thought processes are dealt with and made more realistic. But interestingly, there's a brain site associated with negative self-talk. That was something that was discovered about 2 or 3 years ago. It's an area on the left side of the brain, just above the ear. And if there's a very specific waveform associated with negative self-talk. And when that's high, the individual is ruminating in a negative way. As we were discussing earlier, that can be a killer for an athlete. It's referred to as the nemesis problem.
Mm-hmm.
If you're a skier and you're skiing down the hill and the third turn is where you've always wiped out, or at least wiped out once or twice, every time you approach turn 3, that replays. And that is very destructive and really affects your performance because you're preoccupied with a negative outcome. So one of the things that we do is get the person to replay that in a positive way and suppress that one waveform. I'm convinced that's what the Italian team did with the penalty shots, to suppress that waveform when they were visualizing positive outcomes from their penalty shot. And then they physically go through the process of doing a penalty shot.
That is amazing because in 1994, it was Roberto Baggio for the Italians that shot his penalty over the crossbar, and they ended up losing to Brazil. And so collectively as a nation, the Italian nation is a soccer nation, well, that collectively weighs on you every time you step to the penalty spot. It's very interesting. And you have a lot of kid athletes too, and that's is that the best time for somebody who's getting into professional sports or getting into becoming a performer or a musician or whatever? Is that the best time to get at them in this regard?
Absolutely. Again, the best example is physical fitness. A child who is interested in a particular sport, they work with a trainer, they work very specific muscle groups and general well-being. And the same thing is true with the brain. You bring the brain into most efficient levels of functioning, and then you enhance the performance of those areas really critical to his skill.
Dr. Paul Swingle is on the air from Swingle and Associates on Melville Street in downtown Vancouver, just off of Pender Street. Dunsmuir becomes Melville Street, and you have treated patients, I guess into the thousands now over the past little while. And whether it's for brain brightening like the elderly, where it's three treatments a year is probably a good way of going, to some more difficult afflictions like alcoholism. The one thing a lot of people ask me about this program is, well, how long and how many sessions or how many times do I have to come in before the problem is fixed? And that's, I guess, totally dependent on the individual, isn't it?
Yes, it all depends on a number of things. It depends on how severe is the neurological inefficiency. How long has the person been in that state? What's the chronicity of it, as we say? And some other variables, the environment that the person is coming from. Alcoholism, I think, is a good example. If we deal with a very young individual, then they don't have a long history of alcoholism, that is, behaving in an alcoholic fashion. What we can do is modify the brain activity associated with the predisposition to alcoholism, get them into some support group like AA, and then secondarily work with them on changing their environment. The statement that I make to every alcoholic is, I cannot keep you sober on a bar stool. Now, The point, obviously, is that you have to change lifestyle in order to deal with some of these problems, because your lifestyle is built around the predisposition for your alcoholic behavior. Same is true with drug use. You change the conditions associated with the use of the drug, in addition to the other things that we're doing.
You've dealt with heroin addicts, people on marijuana, cocaine, all these people. And one of the things that your technician said was there does have to be a willingness and a commitment to continuously coming in. And that's a big challenge for people who are addicted too, isn't it?
Absolutely. We get a lot of people who are brought in by other people. And the first thing we do is determine the level of commitment of the individual who we're treating. You can't do it for somebody else. You have to do it for yourself. And if you're not doing it for yourself, then success is not good. And it's not good for any of the treatments. You know, the rehab centers, their success rate is about 15%, not very high.
Swingleandassociates.com has a lot of information about the many conditions that you help treat. Swingleandassociates.com. And there's all sorts of information on there, including how to contact the clinic at 604-608-0444. We've been talking today about performance because a lot of times we're talking about things like depression and, rather negative conditions. And so today we've been talking about how to brain brighten. And one of the aspects of that is CEOs from big companies, not only here but around North America, that come in to actually have their brain sharpened.
Yes, we see a fair number of senior executives. It's a very good investment for a company to increase the brain power of their employees. As I've mentioned earlier, just doing regular neurofeedback will increase the IQ of a child with ADD, for example, by about 12 points. And that's true right across the IQ spectrum. So individuals with more limited IQs gain 12 to 15 points. Those with superior IQs gain 12 to 15 points just with our regular procedures. Then we can focus quite specifically on efficiency, decision-making efficiency, and increasing brain power. So the CEO would come in probably once a month to keep the alpha frequencies, for example, very high and efficient. And if they had any particular event that required that they really be sharp, very often what they'll do is come in once or twice immediately before that event. Now, that's optimal performance. Now, to give you an idea of the process of normalizing things, that is the entire brain, before we move to optimal or peak performance, let's say the CEO has a sleep problem. Now, doing optimal performance with somebody who has a sleep problem without addressing the sleep problem is really working against yourself, because the cognitive processing, cognitive functioning is going to be compromised because of the sleep deprivation. So we fix the sleep deprivation, which increases brain efficiency. Then we do the optimal performance to maximize the efficiency of the brain.
Interesting. And like you said, great investment, whether it's time for a presentation or maybe it's one of those big decisions that people like Mr. Mullally at Ford has to go through right now. Very interesting. We've been sort of gearing our discussion today on performance, peak performance, and brain brightening for the elderly, but we'll happily talk to you about any condition that you'd like to chat about. Let's take a call from Don this morning. Hey, Don, thanks for waiting. You're on with Dr. Paul Swingle on CFUN 1410 AM.
Yeah, hi, Dr. Swingle. I have a question for you. It has to do with cerebral palsy. Can you help people with cerebral palsy?
Yes. It varies tremendously in terms of the amount of benefit that people get from neurotherapy with cerebral palsy. Everybody reports that they benefit to some extent. The question is how much. One of the things that a lot of people report is that they have a better sense of body integrity, is the kind of phrase that they use in terms of greater degree of control or better degree of knowledge about where their body is, body limbs and so forth. We don't know why some individuals respond much more dramatically than others, because it doesn't seem to be anything peculiar in the brain activity that would distinguish one from the other. What we do is exactly what we do with peak performance. We have a look at areas of inefficiency, correct those, and then there's some very specific waveforms associated with body quiescence, what's referred to as the sensory motor rhythm, which is 13 to 15 cycles over the central part of the brain. So that's the treatment that we use for CP. And as I said, everybody reports benefit. The question is how much.
Hey, thanks for your question, Don. Really appreciate it. And if you want the clinic's number, here it is at 604-608-0444. That's 604-608-0444. You've got a busy couple of months coming up ahead. You're in Palm Springs this coming week, giving a lecture to primary care practitioners about neurotherapy and biofeedback. So perhaps the first instinct is not to prescribe medication, I guess, but to put them on a neurotherapy program.
That's right. This is really the new medicine for primary care physicians and primary care psychologists to deal with people in terms of changing the brain activity associated with the disorder. I'm also writing a book, as you know, for the general public to introduce neurotherapy to the general public. That, by the way, is going to be published by Rutgers University Press.
Oh.
They gave us a contract for the book, so I'm looking forward to that being published this year.
So you had the manuscript already done, and now they've agreed to publish it. So we expect before 2007's over?
Let's hope so.
Excellent. We can give some away, perhaps, on this program, maybe?
One to you.
Okay. And then after, off to Palm Springs, you're in North Vancouver for a discussion on seasonal affective disorder around about the end of February, I understand.
That's correct.
So if any of the people listening right now want to get in touch with the clinic, just give them a call at 604-608-0444. That's 608-0444. And space is always limited in these, but we'll try to find out if you can get in. And then in March, you're in Kitsilano to talk about age-related issues and what we've been talking about today. And as you said, 3 times a year, and if you're elderly, you brighten the brain and you have benefits that will certainly keep you from hopefully falling, which is one of the things we talked about earlier, but just being sharper.
Yes, it prevents dementia, and that's the major issue, so that all of your lifestyle functioning is not compromised. It makes a huge difference, just a huge difference.
The next time you're here will be February the 11th, when we'll be discussing post-traumatic stress disorder. We talk a lot about depression on this program. Sometimes it's seasonal affective disorder. Sometimes it's just you're predisposed to it. This is where somebody has had a very traumatic event and is suffering following that.
That's correct. Post-traumatic stress disorder can have a very severe impact on life, of course, and it can have many different manifestations. And the next show, we'll talk a lot about what we can do to restore the person to efficient life.